Hello, everyone. I'm Chris Ruhm with the Ruhm-Insurance Agency. I'm a licensed independent insurance agent located in Cincinnati, Ohio. Currently hold a license in 18 states. Today, we're going to discuss the Medicare Supplement Plans G, N, and HDG for 2024. You can call or text me at 513-496-3877. You can also get a quote at my website, chrisroom.com. At the top of the page or somewhere on the mobile app, you will see a get a quote option, and I provide some options there for you to fill out a form. So let's dive into original Medicare first before we get into Plan G, N, and High Deductible G, because in actuality, you can just go with original Medicare. You don't need a Medicare supplement, okay? So with original Medicare, there are two parts that we're going to discuss, Part A and Part B, okay? Part A is a hospital, and this deductible is a per occurrence. It's $1,632 this year. Last year was $1,600, and the year before was $1,556, and we'll discuss this in a little bit when I get to High Deductible G. Part B, it's $240 this year. Last year was $226. And the year before is $233. If you were on original Medicare and you met the deductible, then you pay 20% of the Medicare negotiated rate. The Part B premium is $174.70, $164.90 last year, and $170.10 the year before. This is assuming you do not have an income-related monthly adjustment because your income was higher. If it is, let me know and I can discuss this with you and possibly help you file an appeal to get it lower, okay? The most important thing to note about Medicare is they do an incredible job negotiating your rate. So if you had original Medicare, it's actually a very good plan. The problem is the Part A and the Part B, there is no cap. So this is why we want a Medicare supplement. If you went with just original Medicare, you can get a standalone prescription drug plan. If you go with the supplement, you're also going to want a standalone prescription drug plan. You can opt out, but if you decide to come back and get one later, the timing can be bad and the penalty can be significant. So why Medicare supplements? It provides predictable expenses. You have the ability to see any doctor or hospital accepts Medicare. You don't need prior authorizations or pre-approvals, and it's guaranteed renewable. And we can discuss that if you decide to get a quote. So let's talk about Plan G first and why it's considered the best. It covers all Medicare approved Part A expenses. It covers Part B 100% after the deductible is met. So that is your only cost sharing with this plan. This plan is considered the richest plan for anyone aging into Medicare after January 1st of 2020. If you aged in before that and you're on Plan F, I highly encourage you to get a quote on Plan G if you're healthy, because I will save you money and show you why Plan F typically makes no sense based on the premium savings. And the premium savings plus the deductible, you usually still come out way ahead. Okay, and other than that, it's the exact same plan. So just a way to describe this easily, it's your premium times 12 plus the Part B deductible. That's your worst case scenario. Who is this for? It's for people that don't want to jump through hoops and simply want the best plan available. If you have chronic conditions or you're aging into Medicare with a serious condition such as Parkinson's, cancer, etc., where you have a ton of Part B expenses, this is a great plan because it's very predictable and you can go to any doctor or hospital in the country for the best care. And you got to just make sure you can handle the rate increases, because with any policy, with any insurance company, all we always see is rate increases. And these policies are no different. Each year you will likely see a rate increase. Plan N is the next plan down. It's a great plan. It's better in some states than others, but even in those some states than others that I just mentioned, it's still a solid plan wherever you are, okay? Because it covers all your Medicare approved Part A expenses like G, and then you're going to just assume a little bit more responsibility. If you go to a doctor, it's going to be a $0 to $20 copay. If you go to the emergency room, it's $50. The Part B deductible is required. Once you hit the Part B deductible, then it pays 100% for those services, so such as like a MRI, CAT scan, you know. And then The negative side of this is what I just mentioned earlier, excess charges in states that allow it. I'm in Ohio, they don't allow it. There's a lot of other states that don't allow it either. Actually, not a lot, there's 7 or 8. But even in the states where they do allow excess, most doctors don't take it because there's a participating versus a non-participating charge that a doctor can take when they get appointed with Medicare, okay, or when they decide to contract with Medicare. The participating rate versus the non-participating rate is a 5%. It gives the doctor about 5% more money if they take the non-participating, but since it charges their clients 15% or their patients 15%, most of them don't do it, okay? But it's just something that you got to keep in mind if you're in a non-excess state, okay? And then this plan is for budget-minded individuals that want to save about 20 to 30% on premium versus Plan G. It still provides predictable expenses. You just have a little bit more cost sharing. And as long as you understand the excess charges and you're able to handle the rate increases that this policy will have, it's an awesome solution depending on where you are and what your risk appetite is. Now we're going to jump over to my favorite plan. It's not for everybody, but I really love this plan. You may have never heard about it, and I'll show you why in the next slide. But to me, it's a great plan for that person that is budget-minded, is in excellent health. You like the idea of Medicare Advantage because there's a lot of zero premium plans, but you want the ability to see any doctor or hospital in the country. And you understand how higher deductible plans work, such as like maybe you're on an HSA. And let's just use a quick example. Let's say you're in the hospital for 20 days and you had a $6,000 deductible on your old employer plan. Well, we know you're going to be out to $6,000. If you were on Medicare High Deductible G plan, you would only be out the Part A deductible this year of $1,632. That's why I kind of mentioned or emphasized the Part A deductible. So let's talk about this plan and what's covered. In 2024, it's $2,800. So that's your worst case scenario is $2,800. Last year was $2,700. The year before was $2,490. This follows a consumer price index that comes out in August that reflects inflation. So we know inflation's been kind of costly the last couple of years, and that's why we've had some significant jumps. It's usually about 1% to 2% max. Some years it hasn't been a jump at all. So in general, even though it's $2,800, again, I don't like to look at the $2,800. I like to look at the Part A and the Part B deductible because the Part A is $1,632. So if you're in the hospital for 20 days, you're not going to even hit the $2,800. And then once you hit the $240 deductible on Part B, Medicare pays 20% of the negotiated rate. So if you had a $1,000 bill, you're only out $200. So whatever you do, just pretend like you have original Medicare when you have this plan. And no matter what the combination of Part A and Part B expenses are, once they reach $2,800, your plan will then pay 100% of the Medicare approved claims. So you'll hand them your red, white, and blue card that you get from Medicare when you turn 65 or whenever you age into Medicare. And then you'll hand them your Medicare Supplement and they keep track. And again, once you hit the $2,800, you're done for the year. It's a really solid plan. And again, you're going to save about 60% on premium, maybe even a little bit more. And if you're in good to excellent health, you got a good outlook on life, maybe you have some good genes in your family, and you plan on living a long time, I'm going to show you how you can save some money on the next slide. This is a few years old, but the point will be the same. I did a rate for high deductible G versus G, and this was 2 years ago. Okay, so this was a male in Cincinnati, aging in at 65. Rates will vary by state, by county. So this just is a tool for you to see what I'm talking about and why I like high deductible G, okay? But these numbers are different now. Even in Cincinnati, this is probably more like $38, $39, $40. And this is probably more like $125 for somebody aging in today for the exact same plan, okay? So not a huge jump, but you know, it is different because there are rate increases and inflation on these plans as well. But so starting at $34 at age 65, we go down 16 years. If we had a 6% rate increase every single year on this policy, we're at $81.46. On Plan G, if we started at $120 and we had a 6% rate increase every year, you're at $287.56. That's why I kind of highlighted the fact that you're able to afford the rate increases, okay? Now, there are situations along the way where, let's say you were up to 180 and you wanted to shop this plan, you could. You can shop these Medicare supplements at any time, and if you're healthy enough, you can make a switch. Not everybody's healthy enough, so it's important to choose a good insurance company when you're making your choice. So I'm assuming here that this person was not able to switch, okay? So these are the numbers they're looking at, okay? So over a 16-year period with a 6% rate increase, High Deductible G, assuming they didn't have any claims, which isn't going to be the case, but assuming no claims, you're going to save $26,493 over a 16-year period. When I did this chart, the deductible is $24.90, the High Deductible G plan. So that means you could have 10.6 years where you hit the $24.90 high deductible and still come out ahead with High Deductible G, okay? Now it's $2,800, so I would say it's more probably around 9.6 times versus 10.6 times, maybe 9.5. I didn't do the math, I'm sorry. But still, that's a lot of bad years to still come out ahead over a 16-year period. 9 bad years, 7 good years. If you're still around after 16 years, you're going to be a happy camper regardless. So this is why you probably have not heard about this plan, okay? Agents don't like it because we don't make money on it, okay? We make a little bit, but if you're an agent and you're making 15%, would you rather make 15% of $408 or $1,440? Over a 16-year period, if I sell you High Deductible G versus G, I've made $2,477 less than with G, okay? Now, this is just a fun little number I did here. If I had 500 of these High Deductible Gs, I would lose $1.2 million. So it's kind of makes sense why you probably haven't heard of it if you haven't. And then I just wanted to go over, I mentioned earlier that I would show you the history, because this is the biggest concern for people. And the people that, want to make this commission, they bring this up all the time, okay? And they try and scare you with how much this could be, okay? But remember, even though it's $2,800 this year, it's not really $2,800 because you're going to have a Part A deductible that could prevent you from getting there. And then Part B negotiated rates are so good that, to get to this is pretty difficult. So even if it goes up to $4,000, your Part A deductible and Part B is what you kind of want to look at first. This is just a cost sharing, okay? Yeah, it's not fun if you hit the $2,700, but it's still way less than most Medicare Advantage plans out there. And the premium is significantly lower than G. So it's a great alternative if you're kind of on the cusp between getting a 0 premium Advantage plan that JJ Walker, Joe Namath advertise, or, the Plan G, which you're maybe a little bit worried about affording and you're in really good health. So again, this is why I love High Deductible G, and you might want to consider it as well. All right. So I appreciate you guys watching today. But when you choose a plan, it really boils down to your health and risk appetite. Everybody's risk appetite is different. I have some solutions out there if you like the idea of High Deductible G, but the $2,700 or $2,800 still scares you. You could supplement it with a hospital and cancer plan. Those are kind of the 2 biggest risks involved with that High Deductible G. And you can make that High Deductible G for maybe $90 to $100 without rate increases like the G plan, a G plan almost, okay? So I can turn your High Deductible G into a G with some supplemental insurance that still comes in lower than the G by itself. So if that's a big concern, but you still like the idea of it and you're in the middle of the road, that could be an option for you. Or ends the right option for you in that situation. So those are the things that you want to kind of think about when you're choosing one of these plans, okay? And then the most important thing that that we got to just keep reiterating, Medigap plans provide freedom and stress-free health coverage. You can go to any doctor or hospital in the country. You don't have to worry about prior authorizations or pre-approvals. All right. So again, I appreciate you watching this. If you found this helpful, please like this video and subscribe to my channel. If you found it helpful and you want to share this with your friends, I would appreciate it. Again, my name is Chris Ruhm. I'm an insurance advisor. I've been doing this since 2000. I'm licensed in 18 states. You can call or text me. If you need a quote, you can come to chrisruhm.com, and there is a Get a Quote tab with some options on there, and you can find the Medicare Supplement form, and you fill that out, submit it to me, and I will get you a quote within 24 hours typically. Have a great day. Hope you have a great 2024, and I look forward to talking with you if you need my assistance. Thanks.